Good morning, everybody. I want to first of all thank the sponsor of this bill for allowing us to convene this important conversation. Councilmember Landau is a crusader. She is someone who's made history, and she's hit the ground running as it relates to a lot of different issues, but especially this particular issue right here. So with that being said, good morning. This is a hearing called to order. This is a public hearing of the City Council Committee of the Legislative Oversight. The purpose of this public hearing is to hear testimony on resolution number 240544. I recognize the presence of a quorum of the committee of the members. Actually, no, I don't recognize a quorum of the committee of the members, so I'll take that one back because we actually don't need a quorum. So I want to thank everybody for joining us here today, and I want to pass it off to the Vice Chair of the committee, Councilmember Landau, who is also the sponsor of this bill, to chair our committee hearing today. Thank you for your leadership, Councilwoman.
Thank you so much, Chair Thomas. Appreciate you. And I would like to recognize also Councilman Curtis Jones, who's here, and we're expecting a couple of other members as well coming in and out through the time. Before we get started, I just wanted to say a couple of things. I would like to also recognize the presence of Councilmember Anthony Phillips, who's joined us. So before we get started, I just wanted to, first of all, say good morning to everybody. Thank you so much for being here. And I want to thank my fellow council members, our dedicated staff, and all of you for being here today. As the first openly LGBTQ member of the City Council, it is both a privilege and a profound responsibility to facilitate this discussion on the disparities faced by the LGBTQ+ community. Today we gather not only to acknowledge the progress we've made in our city, a city that has long been a beacon of hope and advocacy for LGBTQ rights, but also to confront the stark realities that still exist. While we celebrate the milestones achieved through the courage and dedication of our community leaders, we must also recognize that our work is far from over. Despite our advances, systemic discrimination and inequity continue to affect the LGBTQ+ community in critical areas like housing, healthcare, and employment, especially for Black and brown LGBTQ+ Philadelphians. The statistics are alarming. Nearly half of LGBTQ+ individuals in Pennsylvania report experiencing workplace discrimination, and a staggering 40% of homeless youth identify as LGBTQ+. These numbers reflect a deeper, pervasive issue that demands our attention and action. We know that LGBTQ+ individuals are more likely to experience food insecurity, with 26% reporting challenges in affording basic necessities. This is not just an economic issue, it's a matter of human dignity. Furthermore, the health challenges faced by our community cannot be overlooked. A significant number of LGBTQ+ Pennsylvanians struggle to access adequate health care, often feeling misunderstood or inadequately supported by their providers. As we delve into this hearing, the first of what I hope will be many, we must listen to the voices of those affected. Community members struggling to access healthcare and housing, families facing discrimination, and individuals battling a host of other inequities. Their experiences are essential to shaping policies that foster equity and justice. We are fortunate that Philadelphia is home to a wealth of community-based organizations that serve our LGBTQ+ residents. However, there are still gaps in resources. Our goal today is to shine a light on these disparities, to explore the root causes, and to work collectively toward actionable solutions. Two pieces of housekeeping before we begin this hearing. Please note that while we are focused on a handful of issues today, I intend to hold future hearings examining additional issue areas and topics as they arise. Additionally, my office has intentionally kept testimony limited to community members and representatives from organizations rather than members of the administration who were invited to listen. This was intended to give the community space to share their viewpoints and to give the administration an opportunity to hear their concerns unfiltered. I urge each of you to approach this hearing with open hearts and open minds, ready to listen, learn, and advocate for a more equitable Philadelphia. Together, we can ensure that our city remains a safe, inclusive, and thriving home for all its residents, regardless of their sexual orientation or gender identity, and including their sexual orientation and gender identity. Thank you very much. Thank you to members of the administration who are here, including the School District of Philadelphia, the Philadelphia Commission on Human Relations, of course, the Office of LGBTQ Affairs, and any others who I may have missed. I appreciate so much, and I know other people are listening to this streaming at their desks, but thank you, and let's start our important work today. Mr. Sarah, will you please read?
Madam Chair?
Yes, sir.
Could I?
Oh, please. Anybody else?
First of all, thank you for spearheading this issue. Even before you got here, you've been a trailblazer to make sure equity and equality and stopping discrimination in our city. You've been a champion. As a Pennsylvania Human Relations Commissioner, we deal with a great many of these issues at the state level. And I want to put on the record that this is Domestic Violence Month, and that one of the startling statistics that we discovered or heard about was that in the LGBTQ plus community, over half experience domestic violence. And that is a startling statistic that is so disparate in its nature that we need to kind of be vigilant about that kind of taboo that happens every day in our community. So as you proceed with these hearings, I want to keep that in mind, that we should not allow those kinds of disparities in any segment of the population. So thank you for this hearing.
Mr. Sarah, will you please read the title of the resolution?
Resolution number 240544, authorizing the Committee on Legislative Oversight to hold hearings examining disparities experienced by LGBTQ plus community and exploring solutions to achieving equity for LGBTQ plus Philadelphians.
And will you please call the first panel to testify?
The first panel to testify is Jasmine Henderson and Naima Sanchez.
Good morning. Thank you both for being here. Please state your name for the record and proceed with your testimony.
Good morning. Naima Sanchez, she, her pronouns.
Also she, her pronouns.
Please proceed.
Good morning, City Council members and esteemed comrades. I'm Naima Sanchez. I use she, her pronouns, and I'm an out and proud transgender Philadelphian. It is both an honor to have been invited and a responsibility I own to speak about an issue that affects countless lives, the disparities faced by LGBTQ plus communities. Let me, for a minute, share a little bit about my story. I blossomed into my true self during the fall of '96 when I was a 13-year-old and 8th grader at Ada Lewis Middle School in Germantown. I was a youth who was already subjected at this age to 3 years of conversion therapy and treatment with excessive medication for my disorders. The medical and mental health treatment was very to the book, and that was a book that did not include an understanding or had a healthy understanding that supported transgender individuals. We didn't have advanced language and resources for families, and sure didn't have local ordinances like non-discrimination ordinances that protected our community. We didn't have, or should I say, I didn't know that there were agencies like the Commission on Human Relations that would fight for someone like me, or even had a robust network to support my family and my community as they transitioned while I blossomed. I existed, surviving through my teenage years into adulthood while experiencing the deep impact of not having school education, safe housing, and a sense of belonging in my community. This left me influenced to engage in a lifestyle that many of my peers then and many still engage, allowing us an opportunity to meet our basic needs, but putting us at a higher risk of physical harm and impacts of mass incarceration. History showed me I didn't have support from the government, and I sure didn't feel that individuals who represented me in bodies like this would hear my struggle and fight for my life. Even through that struggle, I am here, and it is because of that determination I live to see another day. Despite significant progress over the recent years towards equality and acceptance, LGBTQ+ individuals still encounter persistent inequalities that hinder the opportunities and the quality of life we should all deserve. These disparities are not merely statistical. They represent the lived experience of real people who confront barriers in various aspects of our daily lives, including here in Philadelphia. One of the most glaring disparities is in the healthcare setting. LGBTQ+ individuals are often faced with significant challenges in accessing appropriate medical care. Many of us experience discrimination or the lack of access to healthcare and providers and face a singular focus on a need that stigmatizes our communities, leading to our avoidance of necessary medical care. Studies have shown that LGBTQ+ individuals have higher rates of mental health needs, engage in substance use, and experience chronic conditions. Yet we frequently report feeling unsafe and unsupported in healthcare settings. We must not just advocate for inclusive healthcare policies or the need to train providers to deliver compassionate and competent care, but we must hold those facilities accountable for not providing the adequate care that should be delivered with a thorough panoramic view of our communities and encompassing those said advanced policies and training. In addition to healthcare, education institutions play a crucial role in shaping the experience of youth. Unfortunately, many LGBTQ+ students face bullying, harassment, and discrimination in schools throughout Pennsylvania, even here in Philadelphia with Policy 252. These negative experiences not only impact young folks' academic performance, but can also lead to long-term physical and emotional and psychological harm. It is vital that we not only promote safe and inclusive education environments and continue to support policies like Policy 252, but actively engage in practicing fostering acceptance and understanding that protects and supports the growth of all students. Employment discrimination continues to be another persistent issue. While many places of businesses have made strides to protect workers with non-discrimination policies, there are still individuals who have been fired or denied opportunities simply because of their lived experiences. This reality contributes to economic disparities, with LGBTQ+ people with many intersecting identities often facing higher rates of unemployment and poverty. We must not just call for stronger protections and policies that ensure equal treatment in the workplace, but make sure those efforts aren't going in vain and are creating equal access while providing adequate pay. Moreover, the disparities faced by LGBTQ+ individuals are often compounded for those who are also members of other marginalized groups. For example, LGBTQ+ people of color frequently encounter intersecting forms of discrimination that exaggerates our struggles. It is critical that we understand and address these intersectionalities to create a truly inclusive society. As advocates, allies, and supporters who demand an end to these disparities, each of us has a role to play in dismantling these systems of oppression. We must be proactive in educating ourselves and others, challenging stereotypes, speaking out against discrimination in all forms, and passing laws while pushing initiatives that reduce the harm marginalized Philadelphians experience. It is through understanding and empathy that we can foster a culture of acceptance and equality. I demand we take action now. Let us commit to standing in solidarity with each other. We are not just transgender, gay, lesbian, and queer people. We are a county of individuals from many diverse backgrounds and nationalities. We are a county of individuals who are impacted by an unjust system. We are poor and some are rich. We have jobs and some of us are on public assistance. But the one thing that we share in common is that we are Philadelphians. Together, we can create a society that not only recognizes and supports the rights and access for LGBTQ+ individuals, but actively work to eliminate the barriers we face. As we strive for equality and work to end these disparities, let us lift every voice and every person is valued and empower individuals to live their life authentically. I look forward to working with this committee and to my comrades to investigate these disparities while moving us closer to a Philadelphia that lives up to its mission of community love. Thank you for allowing me to speak. I'm gonna reserve some time to Jasmine. But again, I look forward to working with you all. Thank you.
Thank you. Thank you so much.
So you just heard my comrade talking about
Hang on, can you just state your name for the record? And we
Jasmine Henderson, she, her pronouns. So you heard my comrades broadly touch over certain things, right? I want to give put a face to these problems. So I'm a black trans woman, blossomed into who I am in 2021. I've raised kids, I'm a grandparent, like all this stuff, right? Now, I know I'm a mechanic, but I could not find a job in the city of Philadelphia as a mechanic that's gonna pay me what I'm worth simply because I'm trans. I went to places, they offered me as little as $8.25 an hour. You get paid more than that working at McDonald's. And this is a field that is dominated by men, right? In this city, there is not one mechanic shop that's owned by a woman. Not one. There's female mechanics, but nobody owns one, but none of them own a shop. The only shop I know of within 30 miles of here is Girls Auto Clinic in Chester. These are problems that I'm sure I'm not the only trans person dealing with this, because you see it in other industries and especially skilled industries. Like, these are the hardest ones for us to get into, regardless of what our skill level is or how we show up. Naima also talked about healthcare. Now, recently, this administration has gone on an attack against people who are addicted to opioid substances. In doing so, they are also preventing overdose prevention centers. They are trying to shut down safe syringe exchange. These are things that trans and LGBTQ folk access also. Trans people, especially when I worked at Prevention Point, was very likely to go to one of the mobile sites to get the syringes they needed in order to take the medication that they needed to take every day. Most of those mobile sites are gone, and 3/4 of them don't feel safe going to Kensington, because this city has shown us time and time again that, especially if you're a trans woman of color, your safety is not valued. I hate when I forget stuff.
Take your time.
I mean, it's like, so overall, what we gotta do is start to push for, our mayor says that she wants a Philadelphia where we're all safe and we're all loved and we're all taken care of. But who is that really taking care of? They're throwing an arena in the middle of Chinatown that's it's not only gonna disrupt Chinatown, but it disrupts the whole center city, which is where a lot of medical services are. And it's gonna make it harder for people who are disabled, be it regardless of if you fall in the LGBTQ community or not, just to access medical services, to access anything that's gonna assist them. I urge City Council and the Mayor's office to reconsider some of these plans that they have that are supposed to make this city safer, and consider who they're actually making the city safer for, because it's not for us.
Thank you so much, both of you, for your testimony. Any questions from the panel? From the...
Thank you, Madam Chair. When you say you're denied, what makes you feel that because of your preference, that they're not allowing you to work to your fullest capacity? And have you ever filed a complaint?
I've never filed a complaint. However, when I call these places and ask them if they're hiring, they tell me yeah, because over the phone I sound like a man. When I show up, and I show up as me, regardless of the fact that I have a trunk full of tools and I'm driving a car that I fix on a regular, they just automatically, oh, well, if we hire you, this is what we're gonna hire you at. I had one place actually tell me that although they were looking for women mechanics, they wanted someone who had less knowledge of cars than I did, but more time in the shop so that they could mold them the way that they wanted to mold them. I've been running a successful business from in front of my home in Going Mobley for the last 4 years now. Granted, I'm not making anywhere the amount of money that I would make working in a shop, but it's kept me going.
So I'm not allowed to give you legal advice as a commissioner, but from what on surface you just said, there are grounds that you are being denied and discriminated against. And again, I cannot serve as your attorney, but if I heard this case before me at the state, I would say there are grounds that you've been discriminated against, and something that not just for your own benefit, but for the benefit of people that will come after you that you might want to pursue.
I'd like to call Naima Sanchez for a minute.
Thank you for your question, Councilmember Jones, and respectfully just correcting something on the record, is being trans is not a preference, that's who we are. The preference is to wear that blazer for today, okay? We are who we are. In the state of Pennsylvania, there are many, countless TLGBTQ plus folks who are being discriminated and denied of employment. We are an at-will state, and as Jasmine shared, is that over the phone, someone will commit to something until she is in present with them. And I think that we have to continue to enforce non-discrimination ordinances and hold businesses accountable who discriminate. Also, the ACLU will assist, right? We're not a law firm, but in any modes of active discrimination, if you feel, the ACLU will support you. The Pennsylvania Commission on Human Relations, the Human Relations Commission of Philadelphia will act in your accord. I do think that we need to continue to use proper language as we talk about community, because there is this misunderstanding that we as community members, TLGBTQ plus Pennsylvanians and Philadelphians, have a preference of this. We would prefer to be respected. We would prefer that people reference us as humans, and as this is not a choice of life, right? We choose to come here and speak to you today, and we ask that you continue to expand your knowledge and your language as it pertains to our community.
So my purpose for being here is to hear and to be corrected where necessary so that I can advance my knowledge to be helpful to him. Wait a minute. In places so that I take that knowledge back, so that I know what to do that is helpful. So I don't and didn't want to offend. I'm here to learn.
Yeah. I'll take a point of privilege for a second. One, I apologize on behalf of City Council right now. Two, we clearly have a lot of work to do educating my body, and I will take the forefront of doing that. I want you to know that I will absolutely take the initiative to make sure that I am educating as much as needed here in City Council. And three, I just wanted to get to just the point of, as somebody who oversaw the Philadelphia Commission on Human Relations and took complaints of discrimination and investigated it, I understand that it can be a long process, it can be an arduous process, and it can be something that you've got to be, I don't know, not everybody wants to go through the entire process. But I want to also suggest that the agencies are also here for you in ways in which might be not traditional. For example, even letting the commission know what happened, why you believe you were denied a position at a certain place. They can send a letter for you. It's our belief that we've had some informal reports that you may have denied employment to somebody based on their gender identity. We want you to know here's the law and get started at least in that way. So you don't have to file a full complaint. Filing a full complaint would certainly have consequences for the employer on the end, but I really do think there are ways in which we have to be more forward-looking with not only educating employers, but also letting them know the law and putting them on notice. You do this again, you're in big trouble. So, you know, and that the hammer is coming down. So I want you to know there's more options for you than the full process, if you like.
If I can, council members, to what Councilmember Jones said, you know, and what you're saying, they did not turn me down for employment. What they did was undervalued my skills, right? A mechanic walking in the door who just graduated out of college can get $20 to $25 an hour. Granted, I don't have a college degree. I have 30 years of experience. So that should be worth something, right? I went, and this was in 3 different places here in Philly that they offered me $8.25 an hour. And they do that so that they can say, well, I offered her employment, she just wouldn't take it. Well, I understand my value. And no, I'm not gonna work for $8.25 an hour and I'm busting my behind trying to work on cars. I went to Girls Auto Clinic, the only female-run shop in this city. They were the ones who told me that they were looking for somebody with less experience working on cars, but more shop time. And I'm of Jewish faith, so I don't work on Saturdays. And I told them this during the interview and on my application, and they turned around and offered me a job working on Saturdays only.
Thank you so much for sharing all that. I do want to also suggest that you were turned, if you applied for a full mechanic job and were offered something much lower, you were turned down for that job as a mechanic, and it is something that's actionable. And there are a variety of other ways in which we can talk about religious discrimination as well. The PCHR is here in the room, happy to talk to you as well. And I know the ACLU would be interested as well too, but the important thing, what I think we heard from both of you is how prevalent and how pervasive discrimination is, how much the doors are being shut, and how we have to work collectively as a community, as Philadelphia, to make sure all doors are open for everybody. The term not regardless of your gender identity or sexual orientation, but also because you're coming as your full self, as your full you. You clearly have amazing skills and should be hired to, and be gainfully employed at this point. And so Philadelphia needs to step up and make sure that the position is there for you. Thank you.
Thank you.
Thank you both so much.
I don't mean to belabor it,
Okay.
but it's not just about you.
I know.
It is about people who come behind you. And I'm encouraged that the law firm would look at those subtleties. I agree with my colleague that if you're turned down, if they make you a lower offer based solely on who you are, then that is discrimination. And it's about you, but it's about those who come behind you. And I would encourage, there are 3 different levels that you can file that appeal, and they all have different prospective outcomes. But you're fighting not just for yourself, but for your comrades.
Thank you both so much. Appreciate you. Mr.
Thank
Sir,
you.
can you call the second panel?
The next panel to testify is Jasper Leem and Hazel Edwards.
Good morning. Thank you so much for being here. Can you please state your names and your pronouns for the record and proceed with your testimony?
Hazel Edwards, she, her pronouns. Good morning, members of City Council and community advocates. My name is Hazel Edwards. I use she and her pronouns. I work as the Trans Services Program Manager at GALE, which is a queer and trans, Black, Indigenous, person of color, radical social justice organization located in Kensington. I stand here not just as a Black trans woman from West Philadelphia, but as a representative of countless Black and brown trans voices in our community who have faced similar struggles. Today, I share my story a journey that has driven me to advocacy, education, and policy change within the Philadelphia School District. My goal is to use my story to uplift the ongoing challenges faced by our trans and non-binary youth in the education system, and to highlight how we can count on the support of City Council to work towards meaningful solutions. My experience in high school was not easy. I remember the excitement of starting high school, filled with hopes and dreams. I wanted to learn, grow, and find my place in this world. However, I soon encountered a harsh reality. The very environment that was supposed to nurture my education became a battleground for my identity. When I was in my 11th grade school year, I missed about 75% of my classes because I was in and out of mental health facilities and outpatient programs. Nobody knew what was going on with me. The reality was that I was trans, and I didn't feel safe enough to disclose that information with the adults around me. From that moment, I started to express myself more femininely in my senior year. I felt the weight of judgment and misunderstanding. Instead of support, I faced hostility from peers and some faculty members. I experienced bullying that was not only verbal, but also systemic, as the school lacked a clear policy on how to support transgender students. Despite the challenges, I tried to advocate for myself. I approached teachers and administrators seeking guidance and support. Many were ill-equipped to handle my concerns or understand the basic principles of gender identity and expression. This lack of knowledge perpetuated in an environment where harassment was not only tolerated, but in many cases, it was ignored. Eventually, the hostility became unbearable. I had a meeting with my principal and the guidance counselor where I was met with the words, "You are a boy," from our school's guidance counselor. At that moment, I walked out of the principal's office, packed up my locker, and walked out of that school as a student. I was just 4 months shy of my graduation year, and this was almost 10 years ago. I was pushed out of school, then I was kicked out of my home as a result. This experience ignited a fire within me, a determination to ensure that no other trans student would have to endure what I did. I realized that I could channel my pain into advocacy, and I began to understand the power of policy and continued trans education in shaping school environments. This led me to intern at the Attic Youth Center, where I had the opportunity to build networks and collaborate closely with the Philadelphia School District. This culminated in the development of Policy 252, Philadelphia's groundbreaking school district policy designed to protect trans and gender nonconforming students. Policy 252 was meant to be more than just words on paper. It represented a commitment to equity, inclusion, and safety. It establishes clear guidelines for supporting trans students and creates a safe avenue for them to voice their concerns without fear of retaliation. What makes this policy particularly significant is that it was crafted by Black trans youth, including myself, and it was unanimously passed in June of 2016. However, despite this progress, we continue to see challenges for our trans youth in the school system. The inconsistent application of Policy 252 across all schools underscores the inequitable support in lower income districts, which hits our Black and brown trans youth the hardest. Today in my work, I'm reminded on the ongoing challenges that my trans youth continue to face in our education system. In my story, a negative school environment led to homelessness, which led to me doing survival street sex work for food and shelter. This lack of support from a public institution triggered a domino effect that impacts critical areas such as housing stability, food security, and overall mental and emotional well-being. It's essential to recognize that these challenges are not isolated. They are interwoven and impact the development of our young people in their formative years. The interconnectedness of health disparities and human services issues cannot be overlooked. When schools fail to provide adequate support for LGBTQ+ youth, the consequences extend far beyond the classroom. Every organization with the capacity to fund programs needs to invest in initiatives that address these interconnected issues. Currently, there is not enough funding to hire the necessary staff to adequately support our youth, provide comprehensive education, and hold institutions accountable for failing us. Many queer nonprofits represented in this room face significant barriers when attempting to enter schools and connect youth with vital support services. It is simply unacceptable for organizations to operate on shoestring budgets or to rely on our own resources to fund essential services that should be the responsibility of our public systems. In light of this, I urge you, in your capacity as city council members, to ensure that queer-led departments, nonprofits, and mutual aid collectives in Philadelphia receive priority funding, targeted and equitable funding across all nonprofits and grassroots organizations. This funding is critical to building a support network that ensures every trans youth has access to the resources that they need to improve their quality of life. As a city that prides itself on being the city of brotherly love and sisterly affection, we must not leave our fellow queer and trans Philadelphians behind, especially our queer youth. We have a responsibility to set an example nationwide what liberty and justice for all actually means. Let us all work together as a city to ensure that no child is pushed out of their educational environment because of who they are. That messaging signals to our young people that they do not deserve an education. Let's cultivate a world where trans youth and young adults don't have to just survive, but thrive in a society that does not want us here. Together, we can support the positive development of our youth to reach their fullest educational potential. Thank you.
Thank you. Please state your name for the record and your pronouns, please.
Good morning. My name is Jasper Leem. I go by they and he pronouns interchangeably, and I'm the executive director at the Attic Youth Center. And I'd like to start with saying good morning to members of the council, community advocates, friends, colleagues, accomplices, and folks from the administration who were able to join today. I stand or sit before you as an Asian American, a transmasculine Philadelphian, and also as a voice for the LGBTQ youth who navigate a world that repeatedly marginalizes them. This resolution to examine disparities faced by the LGBTQ community in Philadelphia is not just important, it is essential for the future of our young people and our city. LGBTQ youth in Philadelphia face a harsh reality filled with challenges that many of their peers will never understand. They are disproportionately affected by homelessness, mental health crises, discrimination, and bullying. These are not just statistics, they are the heartbreaking stories of the young people who walk through the doors of the Attic every day, who are seeking support and safety. Let's start with housing. A shocking 40% of homeless youth identify as LGBTQ. These young people have often been rejected by their families of origin, forced to choose between who they are and their homes. And at the Attic, we provide case management and some limited rapid rehousing support, but this is not enough. We need systemic change to ensure that every LGBTQ youth can access stable and affordable housing. Every night, too many of our youth are left vulnerable and exposed. Young LGBTQ Philadelphians also report feeling unsafe in the shelters that we have in our system due to their perceived gender, beliefs, and really perceptions of their sexuality and who they are. For our youth at the Attic who are 18 and older, they might go to one of the emergency shelters and just based on how they present and who they are, will be told over and over again that they are not actually safe there. Sometimes directly, sometimes in all of those non-verbal ways that we know we are not welcome in a space, that we know we are not safe. We cannot stand by while they fall through the cracks of a broken system. Mental health is another critical concern. LGBTQ youth experience anxiety, depression, suicidal ideation at alarmingly higher rates than their peers. As someone who grew up just outside of the Philadelphia city limits, I struggled with mental health myself. I'm a survivor of suicidal ideation and several attempts throughout my teens and early 20s, and it is incredibly dark to be in that space. I am so grateful for the few adults and peers that were able to see me and help hold me through that time. And also I'm really grateful for the folks at Prevention Point at the Syringe Exchange who helped me through a time when that ideation became active drug use, and a time when I needed support, and this was outside of being LGBTQ identified. I think it's easy for us to think that our communities live in this bubble, and sometimes we do it intentionally, right? But also we live lives outside of it, right? It should be just as easy for someone like Jasmine to get a job in the skilled trades as, you know, I was told over and over again, oh, stay in nonprofit because you'll find your thing, right? I should be able to also find a job outside of the LGBTQ nonprofit world. I choose to be in it, but I know a lot of folks have skills and have ways that they want to contribute to Philadelphia that are not just in our sector. At the Attic, we work tirelessly to provide mental health support and counseling, and our resources are also still stretched thin. This resolution acknowledges the urgent need for more comprehensive mental health services tailored specifically for LGBTQ plus individuals, and we must prioritize their well-being because their lives depend on it. In our schools, LGBTQ youth face an environment that's often hostile and unwelcoming. I always love talking about your involvement in 252, Hazel, which was such a groundbreaking policy for the school district to adopt. At the same time, I also remember being one of the many ringers for that training because we had, maybe 4 half days in order to do trainings across the entire district. And thank goodness the community came to rise to that occasion. At the same time, 252 does outline a policy on how to protect trans and non-binary youth, but it doesn't do enough to protect also our gay and lesbian youth or bisexual youth. At this point, there is no safety or protection in the school district policies that prevents a lesbian student from being outed to their family and all of the consequences that can happen with that. Our youth experience bullying and harassment that leads to higher dropout rates, diminished academic performance, and we know that education is a key to long-term financial stability and economic advancement. Imagine being a young person who feels unsafe every day in the place meant to be your sanctuary, where you might not even be able to have a group of peers. We must create schools and a culture that nurtures and protects all students, where no one has to live in fear because of who they are. And moreover, we cannot overlook the intersectionality of all of these issues. LGBTQ youth of color face unique challenges that demand our immediate attention. This resolution emphasizes the importance of understanding these intersecting factors, and we must approach this work with an inclusive lens, ensuring that no one is left behind. All too often, we look at inclusivity or equity from a lens only of racial justice, which is great, but none of us live single-issue lives. I cannot identify as someone who is trans without also talking about being masculine and also talking about being Asian, because that is different than some of my other peers. Finally, I want to highlight the role that community organizations like the Attic and many of our peers here play in this fight. We are on the front lines providing essential services, resources, and hope to LGBTQ youth. However, we cannot do this alone. We need the city's partnership to assess existing services and ensure that we effectively meet the needs of our community, and not just in our community, but also making sure that we have a space outside of the LGBTQ community. This resolution represents the opportunity for real change, an opportunity to listen, to learn, and to take action. In closing, addressing the disparities faced by LGBTQ youth is not merely a policy issue, it's a moral imperative. By supporting this resolution, you are making a powerful statement that every young person in Philadelphia deserves a chance to thrive, regardless of their sexual orientation or their gender identity. Let us stand together and ensure that the future is bright for our LGBTQ youth. And thank you for your time and for your commitment to creating a more equitable and inclusive Philadelphia.
Thank you both so much for your testimony and for highlighting the safe spaces that you've created for LGBTQ youth, for sharing your personal stories. It's just incredible. And Hazel, I've known you since you were a teenager, and to watch you rise to such a level of leadership is incredible. And just thank you for what you do and for highlighting including the fact that we have a tool, Policy 252, that we are not utilizing enough or training enough on. So very much heard. Thank you. Chair would like to recognize Councilmember Anthony Phillips.
Thank you, Councilmember Rulandau. This has been invigorating and enlightening experience. Also, it also helps us to challenge City Council to listen to really important issues in our city. So we're extreme gratitude today for coming forward. I just have a couple of questions. The School District of Philadelphia has been noted with having many issues around the question, the problem of bullying, and it's become something that's become really apparent for me over this past year, and also even in my experiences with the School District of Philadelphia as a student, bullying was present for myself. What are the resources available to LGBTQ plus community members in the School District of Philadelphia if they're experiencing bullying? If not, if the resources aren't strong, what are some of the suggested resources that you have in mind that we should look into working with them on? Hazel or Jasper, either one.
Yes. Thank you for asking that question. I currently work as the Trans Services Program Manager, also known as the TINGS program over at Galay. Over at Galay, we provide comprehensive services for trans and non-binary communities, specifically young people, people in the Kensington area, where we do one-on-one direct services, as well as referral and link community into other community resources, such as the Attic. And yeah, we also provide trainings on gender, sexuality, and race-based oppression. And I also was instrumental in supporting the trainings for the Philadelphia School District Administration. Just like Jasper shared earlier, there was training, a mass training, where we trained all school administration top to bottom in 2016. But ever since then, there hasn't been training for all school officials since then. That is about 8 years ago. And so kind of thinking about the ways that time happened is like one of the things that we are advocating for, and I'm sure that Galay is able to show up, as well as I'm sure the Attic are, with providing continued education and continued training services to support the administration and staff in schools, as well as going into schools and supporting QSAs and supporting the development of young people to reach their fullest selves, right? You know, my favorite book is Luna, and my favorite movie is Tangerine, but how am I able to engage, in, how am I supposed to find community as a young person if I don't feel if I don't feel comfortable sharing about my favorite book? How do I feel comfortable sharing my favorite movie, right, as a queer young person, finding community? And so having community organizations to show up and create those spaces for young people is very vital.
No, thank you. That was helpful. And Jasper?
If I may, I 100% agree with you, Luna, or Hazel. I was thinking about also, the school district has certain policies and procedures in place for any kind of bullying, correct?
Yes.
And at the same time, I hear from our youth who are students all the time that they were bullied or mispronounced or treated adversely, both by students and faculty and staff. because of who they are, because of their gender identity or their sexual orientation. They go through that process and they're told, well, too bad. And so there is a fundamental training issue across the school district. Like Hazel said, we haven't done this training across the district in 8 years. And so there are a lot of administrative staff, a lot of, teachers and faculty. There's been a lot of turnover, right? We've had a whole pandemic since then. And there's a lot of new folks who don't really understand that policy or don't even know about it, or are still uncomfortable figuring out how to implement that policy. I think that I speak for all of us when we say, like, both, the Bryson Institute, which is our training arm at the Attic, as well as the folks at Galay, like, we are ready to provide that training. We just need the green light.
No, thank you. I think you provided me with information that we need to advocate on behalf of this issue. So thanks a lot. And I'll reserve time later for other questions, but I was, particularly intrigued not only by this bullying issue, but also the funding gaps for nonprofit organizations that serve the LGBTQ plus communities. And I just wanted to get a better sense of, how do we make that stronger? So, and I also think that there should be a better referral process where if there is if students are experiencing, based off your testimony, Hazel, if students are experiencing bullying and they're looking for a community that can support them, if there was training, teachers, principals, staff, they probably could say, Attic, like all the organizations that exist, but I don't think they know. And I think that's going to continue if we don't make sure that there's training there. So thank you.
Absolutely. I think, on one hand, it's great to refer folks to us. Our doors are always open for our LGBTQ youth in Philadelphia. And at the same time, they should have that same safety and equity in their schools.
That's it. Thank you for that point, Jesper. That's really great. I want to, for 1 second, also just note that Councilmember Anthony Phillips is the chair of our Children and Youth Committee, so it's particularly great to have you here. And also just to say, back in 2011, I believe, I was part of training all, not just staff, all adults in every school on the school district's bullying, and what was then the new bullying and harassment policies. So to say that not only is it possible, it is, we can train not just the teachers, but all adults in all schools, and to how essential it is to have expert trainers like yourselves, especially folks with lived experience doing this training. This isn't something where you just, hand it out to people or have, the superintendent tell everybody what the training is. It's essential that people see real life experiences and hear it from you, which is why the training, and that's how you make it the most effective. So thank you both so much for your testimony. Great, thank you. Mr. Sarah, can you call the next panel, please?
The next panel to testify is Sultan Shakir and Rosemary Thomas.
Good morning. Can you please state your names and your pronouns and proceed with your testimony?
Good morning. My name is Sultan Shakir. I use he, him pronouns, and I'm the president and executive officer of the Mazzoni Center. The Mazzoni Center is a comprehensive health and wellness center serving Philadelphia's LGBTQ community, and we're the largest LGBTQ nonprofit of any kind in our city and in the state, which makes me proud to be a resident of this great city. For over 45 years, we've grown from being an all-volunteer organization formed to care for our community during the onset of the AIDS epidemic. Today, we are a 130 staff organization serving over 15,000 clients each year with services including medical care, behavioral health care, legal services, housing support, and a food bank. For many of our 15,000 clients, Mazzoni Center is the only place they feel safe and affirmed coming for care. If we did not exist, many would simply go unserved. With the core principle to never turn away any member of our community that lacks the resources to pay for care, we give away over $1 million in services each year. Over the 4+ decades of our history, Mazzoni Center's work to provide and expand life-saving services is something that we haven't accomplished alone. Our success relies on the many successful partnerships with funders, with other medical facilities, with allied community partners, and with city and state government. As we work together to advance equity for our LGBTQ community, here are 2 ways in which the city's continued and/or increased support can make a major impact. The first is security. It should come as no surprise that security concerns for LGBTQ individuals are only increasing. With the rash of right-wing rhetoric and violence against LGBTQ individuals and communities, including an increase in political activity and targeting of the LGBT community, with the rise of hate groups, the radicalization of individuals, and the tragic reality of assaults and murders of LGBTQ individuals, the need for increased security training, infrastructure, coordination, and protection is paramount. Earlier this month, right before our fest, Mazzoni Center received a call from an unknown individual threatening to blow up our building. It rattled our staff, but we worked with local and federal law enforcement to continue operating, even with the looming threat. Unfortunately, such calls are not unusual. Despite the needs increasing, it's difficult to identify security consultants, agencies, or personnel who have the competency with regards to the specific needs, sensibilities, and sensitivities of the LGBTQ community. This cultural competency is particularly important given that we work with individuals who've often experienced trauma, often trauma including law enforcement. Mazzoni Center is partnering with other allied organizations in Philadelphia with a goal of creating a network of organizations to collectively hire a full-time Philadelphia LGBTQ Joint Community Security Director. This position would be employed by Mazzoni Center and would work to serve as a connector for all participating LGBTQ organizations when it comes to safety, providing services including ongoing security training, and development of security and emergency response plans. It would also include on-call consulting and serve as a community-wide liaison to law enforcement on the city, state, and federal level. Most importantly, this LGBTQ Community Security Director would have the sensitivity necessary to serve our community, which is critical to build a sense of trust and confidence. Mazzoni Center has secured $100,000 in grants from the Pennsylvania Commission on Crime and Delinquency for 2 years to establish this position. But we require $50,000 per year in matching funds, which we have requested from the city. The first conversation began over 6 months ago, and we are seeing an increased need for this position. And the city's financial participation in providing these matching funds will play a vital role in enhancing the safety and security of our extremely vulnerable and targeted community. Each additional day of delay in establishing this role could be a day that a received threat could turn into a tragic reality. The second issue is timeliness of execution and payments on grants and contract awards. Mazzoni Center, like many other nonprofits in this city, serves as a key partner in implementing social and human services on behalf of the city. One of the challenges with city grants and contracts is the often weeks or months delays in executing contracts that have been awarded, even renewals, in which Mazzoni Center and other nonprofits are expected to continue the work, to continue paying staff, but where the contracts are not finalized, so we are not able to be reimbursed for expenses that have been incurred. Part of the challenge is the duplication in information that needs to be shared. While we appreciate the need for checks and balances, the inefficiency is a bit overwhelming. As an example, for one grant, we submitted the same documents, like our board roster, to 5 different people at the city back in May. By the time one of the individuals got around to the paperwork 4 months later, in September, one of the annual expiration dates on the documents had expired, so we had to resubmit new paperwork to all 5 individuals and restart the process for a grant that was already awarded. The staff at the city and at our nonprofits are fully competent to create a more streamlined system that provides the information city agencies need to do their due diligence while also allowing nonprofits to spend time and resources on providing services rather than repeatedly emailing city staff to check in on what's needed to finalize contracts that have already been awarded. In addition, at the time of this writing, we had 3 grants that we were not able to submit reimbursements for due to not receiving a response from one person that needed to complete the grant renewal. This is even after multiple attempts from multiple Mazzoni Center staff. It finally got escalated to me, the president of the organization, and I even had to send multiple follow-ups, including the director of the city agency, to get the person we needed to respond to the requests. I would love to engage the city to work with our nonprofit partners to create a system that is mutually beneficial for our city and for our nonprofit workers. I hope we can work with the city to create a simpler process where organizations meet with grant managers and resolve any open issues at once, prior to the start of the contract rather than after. Otherwise, we have no ability to pay the staff who are working on behalf of the city. The last part about grants is this. Even after the grants are fully confirmed, there's also a challenge with delays in reimbursements. One of the many examples from Mazzoni Center is the HOPWA program, standing for Housing Opportunities for Persons with AIDS, a program for which Mazzoni Center advances approximately $100,000 per month in rent subsidies on behalf of the city. These are rents for individuals who are HIV positive, low income, and most often Black and brown. The grants also pay around $50,000 a month to support in staff to support clients in the program to help them navigate a range of challenges. Recently, Mazzoni Center had experienced significant delays in reimbursement of HOPWA subsidies from the city. At one point recently, Mazzoni Center hadn't been reimbursed for the program since March, meaning that our organization had advanced over $600,000 on behalf of the city that hadn't been reimbursed. The situation nearly resulted in our having to take out a loan and paying fees and interest simply to make our biweekly payroll and to pay our staff. After significant effort and desperate pleas with the city, we received a deposit on the last possible day before potentially missing payroll. We appreciate the city finance department's help with this matter in the final hours, but what we ask for is a more consistent process for grant reimbursements. Similar to the work I'm sure we can do together on the grant conforming process, I'm sure we can create a system where nonprofits can count on the city for timely and consistent reimbursements. If we paid our staff on the unpredictable schedule that the city pays us, no one would work for a Philadelphia nonprofit. Lastly, in parallel to city grants, Mazzoni Center was notified by members of the City Council in early July of $150,000 in grant funding in the current city budget for a new high-impact STI prevention project at our Washington West facility. While we have begun implementing that work, these funds still have not been received by the city. We asked that there be a way to inquire about the timing of these funds. To close, we appreciate the partnership with the city working to take care of vulnerable residents. Continued delays in funding and reimbursements are having significant negative impacts on our and other organizations, undermining our ability to sustain life-saving services and to advance health equity to our community members. And so we ask for partnership and follow-up in resolving these ongoing challenges. Thank you.
Thank you so much. We'll hold comment until after. Please, before you proceed, I wanted to recognize Councilmember Jamie Gaudier, who's here. She is sitting in her chair because she's technically not on the committee, but wanted to be here in support. Thank you.
Good morning. My name is Rose Thomas. I use she, her pronouns, and I'm here today to speak on critical issues facing LGBTQ health and healthcare in Philadelphia. I've lived in Philadelphia for the past 19 years, and I'm currently the Director of Operations for the Penn Medicine Center for Health Equity Advancement and Program for LGBTQ+ Health, where I have worked since 2015. As someone who has worked within healthcare for all of my professional career, I'm deeply aware of the barriers that LGBTQ people face when trying to access care. These barriers worsen disparities in health outcomes, particularly for transgender and gender diverse people and LGBTQ people of color. The Penn Medicine Program for LGBTQ Health has worked since 2014 to try to address these issues, but more work needs to be done. Today, I'd like to highlight several key areas. One is access to culturally affirming care, the variability and quality of that care, financial barriers, healthcare workforce issues, the ongoing pathologization of LGBTQ identity within healthcare, and then the lack of reliable data to drive interventions and guide solutions. So access to care is still a significant issue for LGBTQ people in Philadelphia, and while many health systems and healthcare providers have made strides, we still see a lack of providers who are knowledgeable about specific LGBTQ care clinical needs, or who provide care in a culturally responsive manner. For many, finding a provider who can address both their health concerns, partner with them to meet their goals, and respect their humanity feels like an impossible task. LGBTQ individuals of color face additional barriers due to the compounded impacts of discrimination based on race, sexual orientation, and gender identity. Access is further limited by geography and insurance status. With certain areas of our city and region, people have to travel very far to reach a provider who can meet their needs, and those who are or underinsured facing financial barriers. A 2022 survey by the Center for American Progress found that LGBTQ adults are 2 times more likely than heterosexual and cisgender adults to avoid care due to cost prohibitions. Those with insurance still face complex healthcare systems that are difficult to navigate for anyone, but add in the component of trying to identify culturally affirming providers, and it becomes more difficult. Penn Medicine has been working to close this gap by expanding our network of providers across the region outside of the Philadelphia area through consultation and training with our program, as well as hiring a full-time patient navigator. Our LGBTQ patient navigator in the first year of employment has helped over 1,000 individuals access care at Penn Medicine or at other institutions across our city and region, and that's just one person who's able to do this. When people are able to access the care, the variability and quality of care is highly differentiated across providers. There's no set standard of care by any medical society or accrediting body for what it means to be LGBTQ affirming or culturally responsive, leaving it to individual providers to self-designate as LGBTQ friendly, in quotes, without any kind of formal process or monitoring to ensure they have the requisite knowledge and skills. This lack of standardization results in care that can be inconsistent and at times harmful. Patients report experiences where their gender identity or sexual orientation has been questioned or disregarded, and where basic health needs are not understood or addressed. The 2022 United States Trans Survey reported that those individuals in the survey who saw a healthcare provider within the last 12 months, almost half of them reported at least one negative experience because they were transgender. Those range from being refused health care, being misgendered, having a provider use harsh or abusive language, or even physical violence. Penn Medicine has worked to develop internal standards for what it means to be a Penn Medicine provider who is LGBTQ affirming, and we hope that these can expand beyond our system and be a standard for the industry and regionally and nationally. I give a lot of talks internally at academic conferences, and one thing I always say is if we aren't counted, we don't count. And so a crucial factor contributing to health disparities within the LGBTQ community is the lack of reliable population data. Without this data, it's really impossible to know the scope of the challenges or to create appropriate policy solutions to impact those challenges. Efforts have been made regionally within health systems, within government, within nonprofit agencies to collect data, but it is limited. This lack of data further exacerbates health and healthcare disparities and hinders efforts to really distribute resources where they're most needed. In addition to lack of data, insurance, and access, many health insurance plans deem certain procedures as cosmetic or not medically necessary when they are critical to many aspects of gender affirmation and highly desired and needed by our transgender and gender diverse patients. In particular, hair removal, vocal surgery, or vocal therapy, and the preservation of sperm and eggs for future fertility and family building are often not covered, leading to high out-of-pocket costs, which further worsens disparities between LGBTQ individuals who can afford those and those who cannot. We also know, studies have shown us, that a key factor in positive outcomes and experiences for many marginalized individuals is having a healthcare provider who reflects your identity. And that is true for LGBTQ people as well. When LGBTQ patients can see providers who share their identities or have understanding of their lived experiences, they report higher levels of satisfaction and there are better health outcomes. Unfortunately, our LGBTQ plus workforce in healthcare is highly underrepresented. LGBTQ providers, medical providers across all disciplines and staff face discrimination, unequal benefits, and fewer opportunities for advancement within their institutions due to bias and discrimination. This contributes to burnout and high turnover rates for those staff, further reducing the number of providers available to meet patient needs. Additionally, when there are providers who engage in culturally responsive care and provide specifically gender-affirming services, they can be at risk of criminalization, not in Pennsylvania currently, but in other areas, and public harassment, even within Pennsylvania and the city of Philadelphia, which results in their pervasive fear, continuous trauma, which is really exacerbated by the national efforts around this, and dissuades individuals from pursuing this as their specialization or publicly sharing that this is the work that they do, further limiting access. Underlying all of this is really the transphobia, medical racism, and the pathologization of LGBTQ identities in medicine generally. There's a long history of this throughout all of medicine. Medical education, diagnosis, and treatment have really focused on LGBTQ identity as a problem to be solved rather than a holistic part of an individual. Transphobia and medical racism are embedded within our healthcare institutions, resulting in unconscious bias and overt discrimination that harms patients. People report being treated as if their identities are a medical problem to be solved, rather than being supported in living their truly authentic lives. And these experiences of bias, combined with the broader systemic issue of racism in our society, result in severe mistrust between LGBTQ patients and their providers, resulting in poor health outcomes and limited access. In conclusion, the health and healthcare disparities faced by LGBTQ people living in Philadelphia and beyond are urgent and must be addressed with comprehensive and culturally informed solutions. We need to increase access to culturally affirming providers, develop what a standard is for LGBTQ care, collect data on our populations to know where the needs are greatest and how to respond, address the financial barriers that benefit some and leave others behind, and support our LGBTQ workforce. Addressing the systemic bias and discrimination within our healthcare system requires a huge cultural shift as well as policy implementation. I commend the council for this hearing, for this effort, and the members of the committee for taking these issues seriously and working to make Philadelphia a place where all individuals can receive high-quality, affirming healthcare. Thank you.
Thank you so much. I want to go backwards for 1 second and to just say that to Rose Thomas, that was very comprehensive, and through all the panelists, what it's making me realize more than ever, hearing it in one place at one time, is really how much that all of the disparities that are facing the LGBTQ plus community, especially for black and brown individuals, low-income individuals, young people, is that these end up being kind of a mental, emotional, physical, and financial tax on people that other folks don't have to pay. And that there's even distilling it down to the monetary amount, what you're saying, other than we have a real personal consequences to it, but even coming down to the monetary, the things that aren't covered in healthcare, the ways in which bias and discrimination, not getting a job that you should be, that you're very eligible for. And even, just what we're talking about, safety and security, folks who don't want to take SEPTA and end up having to take ride shares places. Like there's a daily tax on folks that other communities are not paying, and until we make sure Philadelphia is fully equitable, people will still pay the mental, emotional, physical, and financial tax that we can't have, because that makes us have two different societies. So I thank you so much for the work that you're doing, and really want to make sure that we break down these barriers and make sure that healthcare is accessible for everyone. And to Sultan, with your, thank you for your bravery of talking about, first of all, the wonderful work Mazzoni Center does, but really talking in detail about how painful our contracting process is here in the city of Philadelphia. We have been working very much with the administration to try to untangle what this archaic process is, but we have heard from many, many, many organizations, feels like it's getting worse recently, about payments that are not being made to organizations that are doing the work, have already done the work, have approved the work, have approved invoices, and are really the arms of the city. We can't do everything that needs to happen in the city of Philadelphia, so we have all of these great nonprofit providers who are partnering with us and making sure you're on the ground, you're culturally competent, you're doing the work. We thank you so much for that. We need to pay you quickly and fast for the work that you have already agreed to do, that you're doing so competently. So we will, that's a huge puzzle, and I wanna take it apart and make it, the 500-piece puzzle should be a 100-piece puzzle. Let's make it smaller. Let's make it something that makes much more sense, that we can quickly, in 2024, coming into 2025, pay our nonprofit providers as quickly as possible for the amazing work you're doing on the ground. We never want you to be in harm's way having to take a loan, and we certainly don't want your staff to even have the fear and the risk of not being paid. So thank you for all that you do.
Appreciate that. Thank you.
Thank you. And Chair recognizes Councilmember Anthony Phillips.
This is why, thank you so much, Chair Rulandau. I just want to say, this is why I'm so excited that Councilmember Rulandau orchestrated this, because this is what our city needs in order for us to really, truly be like this collaborative city where we're all working together to make sure that we're solving each other's issues. I just want to say that, just quick question and a comment, the Mazzoni Center is one of the best spaces in the city of Philadelphia from what I've seen. Every organization, every space has its own issues, but in terms of quality care and actually really great people that work there is amazing. So I just want to start off by saying that. It's unfortunate that the Mazzoni Center is probably, and I could be wrong here, probably one of the only spaces in Philadelphia where LGBTQ plus individuals can receive access to services where you can really understand, there's training there, right? And there's a lot of spaces that don't have that particular training. But the problem is that if we're not funding the Mazzoni Center properly in time, it's going to be hard for us to, give individuals access there. So that's why our team over the 9th District, we introduced legislation to work on helping our city do better with transparency
a special committee to really help understand, not only with transparency, but also really getting rid of bureaucracy. So I hear you, I affirm what you said, and we really need to have a better understanding of the timelines of when are we going to finally get over this hurdle of these delayed payment processes, because it's just not the Mazzoni Center, but it's pretty much every organization in the city of Philadelphia that is going through this. And it's, at this point, unacceptable. And if we need to, work together collaboratively with the administration, then we'll do so to do that. So, and I just also understand, it's like, is it, just, Rosemary, if you could just comment, is the Mazzoni's, you talk about there's not enough healthcare providers that are culturally affirming. Does the Mazzoni Center, is that, or LGBTQ plus community, are we looking for more and more spaces to be like the Mazzoni Center, or we're just looking for every space to be able to get this right? That's all I want to say.
I'm a both and kind of person, so I think the Mazzoni Center is a premier example of what LGBTQ care could and should be, but we are a city with many major health systems, and I really believe that LGBTQ people should have the choice of where they go and the choice of providers. So the goal would be to create more spaces like the Mazzoni Center or expand their access, but also embed in every health system, every care provider, there should be a choice where a person can go and receive care that respects their identity. In particular, I know Mazzoni refers to Penn Medicine for a lot of specialty care, cardiology, different things, and they should be able to send their patients and know that their patients will have a safe experience at whatever other system they're sending them to. So I think both.
Yeah, and we would agree. Like, we don't want to be the only ones, and I would not say we are the only ones. There are definitely other culturally competent healthcare providers, and as she mentioned, we refer our patients to other providers for other care. And we didn't start because we wanted to be the only one. We started because literally no one was touching the LGBTQ community, like would not go into the home of someone who was expected to be queer because of the AIDS epidemic. And so that's why we were founded, is because of a need, and a need that still exists.
That's great. Thank you.
Thank you. And
Thank you.
considering you're a little younger than I am, Councilmember Phillips.
Definitely.
The youngest
I don't know
on council.
going on here.
I wanted you to know there was a time when the city of Philadelphia wouldn't pick up the trash of people with HIV and AIDS.
Wow.
We've come a long way from there, but this is, there was a lot of reasons why the spaces were created, and unfortunately we're still here. Rose Thomas, just want to jump in and thank you for one statement in particular that you made, that when LGBTQ plus people come to healthcare, with many identities, these are not problems to be solved, but instead they are looking for support and healthcare for the whole individual. Thank you for that so much. Thank you both. I appreciate you. And now we are going to move on to public comment. So these are folks who were not signed up originally, but people who have signed up for public comment. We're going to call up panels of 3 at a time. And I also want to say for the record that we have written testimony from Christy Mallory, from the legal director from the Williams Institute School of Law, and Shania Meacham, and Alyssa Turber, not doing great with that, from Valley Youth House. We have written testimony from them. So if you could call the first 3 people. Thank you.
Jason Bowman, Nakia Outland, and Monica Copestakes.
Jason Bowman's been a little busy recently. Thank you for being here.
Of course, my pleasure.
Do you want to call 2 more, or no, you just want to? Okay, we're going to call, if the other 2 people are not here, we're going to call 2 more names so we can get folks up. Oh, wait, I'm sorry. There is one other person. If you could state your name and your pronouns for the record, and please proceed.
My name is Jason Bowman. I use he, him pronouns. I want to first say thank you for allowing me to have public comment today on this very touching issue. I stand before you as the Vice President of Philadelphia Black Gay Pride and a proud member of the house and ballroom community here in the city of Philadelphia. My journey has allowed me to utilize my voice quietly behind the scenes for years to advocate for change in the city of Philadelphia. I work tirelessly with Black and brown community leaders throughout the city to make sure that we have programming, funds, resources, and access to care. I also want to highlight the work that Babashi, Transition to Hope, has done in community, because Babashi, The Addict, and the Colors Organization are three organizations that I firsthand have went through my journey in growing up queer in the city of Philadelphia. At a time when growing up in the late 90s and early 2000s, it was not safe to be gay and navigate through these spaces. In 2024, it's still not safe to be gay in the city of Philadelphia. It's also not safe to be Black and brown and be gay as we navigate through these uncharted waters in the city of Philadelphia. I also want to highlight that oftentimes Black and brown voices and experiences are also swallowed by the city's loud white privilege in the city's structure. I know that we have the neighborhood downtown, but the neighborhood downtown has also not been a safe space for Black and brown people, because we all know that the neighborhood does not really welcome people from the hood. As a ballroom participant, I am a mother, a father, a uncle, a brother, a big sister at times to a lot of young Black and brown queer youth. We utilize the ballroom scene as a way to articulate and have chosen family, oftentimes because we are thrown out of our homes and don't have any family to call our own. We found refuge in ballroom. In the ballroom scene, I have been a psychiatrist. I have helped someone find housing. I have housed people. I have clothed people. I have done countless amount of things to help make sure that members of the ballroom community have access and resources to what they need, because oftentimes when they go to a lot of organizations in the city of Philadelphia, they are often turned away because the pot is also exhausted. It's definitely a need to make sure that we have more resources in the city of Philadelphia besides just the nonprofit sector, because I know the nonprofit sector in the city of Philadelphia is oftentimes digging from the same pot. Oh, my fault. It would be nice if we had a community center, much like the William Way Center, but a community center that's dedicated just to Black and brown queer members of the community. It makes no sense to me that we have all of these abandoned buildings and all this gentrification that are happening in various neighborhoods throughout the city, but we yet to have a community space that is dedicated to the needs of the Black and brown queer youth or adults in the city of Philadelphia. Also, when it comes to housing, I think that it's amazing that we have housing for elderly that are queer, but we also need housing for young people that are transitional, whether it's trans, non-binary, youth, because oftentimes when we go to these shelters, I know because I experienced one time in my life where I had to go to one, they didn't know where to place me, and I didn't feel safe in there, so I didn't stay. I decided to couch hop with various friends and family members in the ballroom scene so that way I may be able to have a safe haven of being. In closing, sorry, I'm getting a little emotional. I'm trying to control my emotions. I often hear Mayor Sherrill Parker say that this city is one city, a united city. For this to be one city, a united city where we are able to thrive in community, it's important to not forget about these lost voices of the night. Because I'm tired of witnessing firsthand or helping people navigate through my trans brothers and sisters being murdered. We have tons of cold cases in the city of Philadelphia of trans people who have been murdered. I can go on and on and on, but in closing, I just hope that y'all listen to everybody in this room and actually do the things that y'all say that y'all are going to do, because we look to y'all, for guidance and hope. And I thank you.
Thank you so much, Jason. Thank you. Please state your name and your pronouns for the record and proceed with your testimony.
Okay. My name is Monica Cope Stakes, she and her. I have been a resident of Philadelphia for the last 6 months, 7 months, since April. I recently got out of prison and was returned to Bucks County, where I was told to, my best bet was to go to Philadelphia, register in a homeless shelter, and sleep in the park for about 3 months. So basically, I was evicted from Bucks County immediately. I've been welcomed by LGBT groups here. I'm associated with a group called Hearts on a Wire that has a newsletter for inmates in Pennsylvania state prisons, which I've been receiving inside. But I've been helping with them, and so far I've had a lot of connections through them. And that's the only way I've been able to keep a roof over my head, is connections from other connections. My biggest problem right now for the last 5 months, since I've been in one steady place, has been trying to find employment. The last place I had applied for, a supermarket, just to stock shelves, said, well, we're not taking applications right now, but we'll keep it on file. I am spent the last 20 years in prison, so I have a record and made that clear. Somebody else in the same shelter that I am in, who got out later, and showed up, applied at the same place, and has started working. Now, I can't say that definitely is discrimination against transgenders, but each case is different. But there just has to be more employment for transgenders other than working for other transgender groups and LGBT groups. Thank you very much. I thank the council for at least letting me speak. I'm not much of a public speaker.
Thank you very much for being here.
Thank you.
I want to call on Councilmember Mark Squilla.
Thank you for your testimony. As we heard from a lot of speakers before you, the challenges of not only our city, but outside the city. My question is, when you were evicted from, where Montgomery County?
From Bucks County.
Bucks County.
Yeah.
So I know you went to prison for something that you had done and you were released. You went for 20 years.
20 years. April 2004, I went in from Falls Township, and my social worker at SCI Rockview had all these things that were supposed to happen. My SSI was supposed to restart. I was supposed to get housing vouchers. I was supposed to get clothing vouchers. And this group, picked me up at the bus station and took me to a hotel room, and they put me up in the hotel room for 2 weeks until they found a suitable apartment for me. But as soon as I got into the car with them, the first thing they told me was, okay, there's nothing for you in Bucks County. There are no shelters, there's nothing in Bucks County. Your best bet is to go to Philadelphia, register at a homeless shelter. You'll sleep in the park on a bench for about 3 months until they call you.
Was this an advocacy group?
Yeah, it was a mental health group out of Langhorne. I cannot think of the name of it. I was looking on my phone trying to remember, but the only thing they really did for me is they took me to Pendel Mental Health to see a psychiatrist who said, yeah, you got bigger problems than psychiatric. You need housing.
Well, I'm glad you were able to find some help here in Philadelphia,
yes.
which
yes.
It's a good sign, but the employment issue is something too that we need to work on, and I don't think that it'd be great to partner with our counties too to figure out what's going on, how And advising people to sleep on the street or sleep in the park is not something that I don't think we should be advocating for, but knowing that you are now in a place where you are looking for an employment, I think it is important, and we need to do a better job to make sure that employment is accessible to everybody, so thank you.
Thank you.
I just want to add also that not only are there laws in Philadelphia against discrimination, that you can't discriminate against people based on their gender identity, but we also have a really strong law of fair chance hiring to make sure that people are not discriminating against you based on your criminal record. So the Philadelphia Commission on Human Relations is here and can give you some information on that as well. Jason Bowman, thank you for always being you and showing up with your true, authentic self. Appreciate you so much. Just what you touched on one piece that no one touched on yet, which was the sad reality of the cold cases here in Philadelphia. We need a new forensics lab. There is one that is ready to go right here in Councilmember Jamie Gaudier's district. I'm a big fan of that one, and we just need a final decision to be made where we can open a new forensics lab and to make sure that there's justice when there's horrific crimes, and also send a message to the street that we will be absolutely solving more crimes, and so hopefully that would be a deterrent to committing them, but thank you so much.
Thank you.
Mr. Sarah, can you call the next panel?
Kelly Burkhart, Najee Royster, and Jeffrey Haskins.
Yep. Which way? This way?
State your name for the record.
Sure. Everybody please state your name, your pronouns, and look forward to your testimony.
Thank you. Hi, everyone. My name is Kelly Burkhart. My pronouns are she, her, and I am the LGBTQ liaison and victim witness coordinator for the Philadelphia District Attorney's Office. I want to thank everyone, especially Councilmember Landau, for starting this, and the Committee on Legislative Oversight for the opportunity to speak about LGBTQ identified individuals who have become victimized in our city. And I think that's one of the components that I'm hoping to connect everyone together, because the testimony that many individuals gave today, they are, let's just say, triple number of individuals out there who have been victimized, who are part of the criminal legal system. And I'm the victim advocate who tries to help them at the District Attorney's Office. I'm trained trauma-informed care and the impacts of trauma. And my job is to provide a safe and affirming support for LGBTQ identified individuals as they navigate the criminal legal system. Briefly, in my role, I'm first a case manager. And with that, I help folks navigate the criminal legal system, where helping folks with accompaniment, dealing with victim compensation, restitution, things like that, offering them information and to try to provide them support. But that's where that's where the issue comes with the support system that's going on within Philadelphia's systems, whether it's folks trying to get mental health support because they just dealt with the trauma of being attacked or victimized, and also housing. I'm going to touch on that briefly, but one of the things that I do is we make sure that we train all new ADA classes, assistant district attorney classes that come through. We make sure, and the interns and support staffs. I also do trainings statewide to other victim advocates and therapists, peer support counselors, and things like that, to make sure that we're using proper language. When we talk to attorneys, we have one of our LGBTQ identified attorneys speak about the ethics and what it means to actually work with clients of our community. And on the other side of it, as a liaison, people can call me day or night. I've personally received phone calls on Christmas Day about a murder of an individual who is a gay man. I've received phone calls from folks, you know, in this room when there's issues regarding why hasn't this been reported? This person has gone missing. We need to figure out, you know, who to talk to within the police department or in the district attorney's office about getting the proper information about who these people are, and how, and just making sure that we have all the touch points in regards to being there for community members. It's like Gloria Caceres always used to say, LGBTQ people, we're queer. We care about trash pickup. We care about good housing. We care about, I mean, we laugh, but we care about these things, right? So we also need to also talk about caring about our victims. I'm sorry, I had to bring in Gloria. Briefly, I do want to touch on one of the biggest hindrances, which is our housing system. Oftentimes when people are victimized, especially in domestic violence or intimate partner violence cases, and say they rent an apartment, an incident will happen, the police are called, someone gets arrested. Often, you know, more times than not, I don't want to say oftentimes, but more times than not, a landlord will just throw both individuals out. They have 30 days to get out. Where are they going to go? Are they going to a shelter? Well, our shelter system is very toxic and people are very scared to be a part of it. I see a colleague here, Jay Thompson, and we actually worked several years ago on an individual, was a black gay male, and he refused to go to a shelter, and I think Jay called every touch point that he possibly could, and this person said that there's too much toxic masculinity for me to go to a male shelter, so I would rather just figure it out on my own and continue to couch surf. I mean, that sort of stays a lot with me. And oftentimes people are given a phone number or told to go to an intake center. That's not helpful. That's really not helpful for anybody. And so, because you're scared, because you've just been victimized and you don't want to go to a place with a bunch of strangers to potentially be victimized some more. So one of the reasons why I wanted to speak today was to show that a person, you know, an LGBTQ representative in these major systems can be very helpful to help LGBTQ folks navigate when they are dealing with a case or when they are, you know, just trying to find additional housing because the landlord is deciding to sell the house. I'm just going to lastly leave you with one individual that I met. I'm going to call her Jane. That is not her real name. And I met her during the Code Blue in 2020. She was homeless. She was kicked out of her house because her family, she started transitioning late in her early 30s, and her family kicked her out because they didn't accept her lifestyle. Jane ended up meeting a friend through one of the local organizations, and this person invited her back to their house for safe space to be during the Code Blue weather. Unfortunately, a sexual assault occurred, incredibly traumatic. Police were called, person was arrested. My client inevitably went through suicidal attempts, also ended up, because of those attempts, also had a stroke. They also have been part of the system already because of some of their cognitive needs that they have, and they really need to live in a group home setting in an individual space, but unfortunately, these things don't exist. She needs a case manager because she can't, doesn't understand about how many pills to count out to take. Jane is still bouncing around. She's still, 4 years later, we keep in touch. In fact, she called me yesterday just to say hi. Asked her, she had the opportunity of potentially going into another group home. Well, it doesn't work out because of her limitations with walking up the steps from after the stroke. She now has a lot of pain in her legs, and she's not very mobile. Ironically, Jane is back at her parents' house. They are accepting of her 4 years later, but she still struggles to find safe housing. Thank you, everyone.
Thank you. Thank you very much.
Hello, I'm Jeffrey Haskins. My pronouns are he, him, his. I'm also a reverend, pastor emeritus, retired from Unity Fellowship of Christ Church, Philadelphia. We worshiped across the street at Arch Street Church for years, and then we moved, and we are now dealing with food inequity. I want to start there. That's my first point. I'm going to be like a preacher, do 3-point sermon, 3 points, and then an introduction and a closure. And so that will be briefly and to the point. So food inequity, I want to thank the city for funding the Center of Philadelphia, which I'm a founding member of, which is a homeless, right at Arch Street, is a homeless drop-in center. We work with the Hub and other agencies around the city. We allow for, we are offering showers, we're offering meals. This grew out of the church and Feed the Hungry, as we're requested to do. We have been doing the Grace Cafe for many years. And so food inequities is one. The second one is one that I can tell my story. I am usually an invisible person in the city of Philadelphia because I am an aging individual, and people don't see me as the 69-year-old man who is living with HIV for 33 years and has worked in the field of healthcare for 34 years. So I've seen a lot, heard a lot, know a lot, but I'm not seen. And I think the aging population, whether they're HIV positive or HIV negative, whatever their health status is, healthcare is a #1 issue in not just the city of Philadelphia, but the state, as I'm working with the State Department of Health to do trainings in the different counties. And I'm working with Philadelphia Fight to continue the Project Teach, which is going into 28 years. And now that program is statewide, and other states from attending the USCHA conference, which is the United States Conference on HIV and AIDS, interested in bringing it to other states like Arkansas and Oklahoma, mostly in the South, which a lot of people, we come from the South, and we have an epidemic that's still there. So thirdly, my third and final point, as Kelly said, is the housing shortage in this city. Not just for homeless people, not just for poor people, not just for black and brown people, but for all people. The HIV Planning Council has, which I do serve on, has made housing the #1 priority, mental health the second priority, and food inequities the third priority. There is money sitting in the budget for these 3 events. I think that what we need from the City Council is to move those monies forward. In my experience from working in New York City, when the money sits, the CDC, the HHS, and everybody comes back and asks for the money back if you ain't spent it. So I've advocated for that money to be spent in New York City. Several people at the Department of Health were not happy about that. Changes had to be made, but we are not here to say that, to tell you how to run it, but we're here to help you do a better job and being more proficient in expending the funds to the nonprofits. And so with that in mind, I will turn over to the lady. You're welcome.
Good morning, almost afternoon. My name is Najee Royster. I am a prevention navigator at Babashi Transition to Hope. I am a Philly native, and I've been doing community education for a while. My community members are disproportionately impacted by state violence and systemic oppression. For every dollar you give to police instead of to radical public health initiatives, you are complicit in shortening the lifespan of my folks. The money spent to militarize Philly police could easily fund free and low-cost housing. Every neighborhood you allow Temple, Penn, Drexel, and Jefferson to bulldoze could be shelters for our abandoned queer and trans youth. The planning and funding for an unnecessary sports arena could have easily been used to nourish the community that's already there, in turn nourishing my trans and queer Asian peers. Every year since 2018, I go to Pride and see streets lined with my oppressors, and I can't help but think of visionaries and leaders like Marsha P. Johnson and Audre Lorde. Marsha, as a reminder of Stonewall and Pride being an anti-police protest, and Audre to remind me that I cannot dismantle the master's house with his own tools. Every year I celebrate with my community for surviving another year and celebrating those we lost. Every year I am reminded that cities and corporations love to patronize us with rainbow flags and packaging, cheap giveaways and buzzword-filled PR statements, sharing their commitment to my community. They will blow a lot of smoke trying to one-up another in their pseudo-diversity campaigns. However, neither the companies nor the cities are paying living wages. LGBTQ+ people are trapped in a vicious cycle stacked against us. If I can't get hired because I'm queer and or trans, I have to turn to other avenues in order to sustain myself. This could mean theft, sex work, street pharmaceuticals, or any other crime, but how is it fair for me to be arrested if I am not offered any alternatives? Funding police to arrest us for survival crimes instead of initiatives making survival crime unnecessary is both stupid and yet another enabler of a supremacist police state. If the penalty of a crime is a fine and community service, it's only a crime for people who can't afford the fee. And so when your doctors, nurses, teachers, cops, detectives, council members, government officials, and public servants are at best ignorant and at worst willfully compliant and malicious oppressors, how can we truly survive here? How many of us have to die before you stop doing roundtables, press tours, and town halls, but actually start doing something? Why is it up to nonprofits and true community organizers to do the job of the people my taxes pay? At this point, refund me my coin. The next time you brag about our diverse city to win some woke points, remember that orgs like Babashi, Galay, Philly Fight, Mazzoni, William Way, Morris Home, The Attic, Colors, Prevention Point Sisters, Savage Sisters Recovery, and many more amazing orgs are overworked and underpaid, serving the people you brush off as collateral damage in your efforts to maintain colonialism, white supremacy, and state violence. Stop asking us to be kind and patient about our grievances when your actions and policies are predatory and deadly. Diversity in government doesn't matter if the diverse leaders are only invested in replacing those in power instead of shattering the system. I would also like to make note that during this town hall, I have heard misgendering, I have heard improper language, I have watched y'all look bored, almost look as if you were falling asleep. I have watched you on your phones, and then at the end you pop in with some questions. I need to know, are you actually going to do this work, or are we going to have to continue to have conversations telling you how to do your jobs when you allegedly were elected because you already were qualified? Thank you.
Thank you. Thank you very much for your testimony, all of you. Appreciate you very much. We're going to call the next panel. We heard you. We heard you loud and clear. Thank you very, very much.
David Fair, Safo Fulton, and Jai Thompson.
Before you get started, too, I didn't realize that we were running up against another hearing, so if you could keep your testimony to 2 minutes apiece would be great. Thank you. Please state your name, your pronouns, and can't wait to hear your testimony.
You can state your name first. My name is David Fair. My pronouns are he and him, and I'm here this morning representing the Philly Homes for Youth Coalition. A few years ago, researchers from the University of Chicago conducted the first, and to date, only, in-depth needs assessment of youth and young adults who were street homeless in Philadelphia. They found that on any given evening, while most of us are sitting down to dinner, over 600 Philadelphians aged 14 to 24 are not doing that. That's because they are living on the street, living doubled up in the home of a friend, or in the home of a trick, or some other person aiming to take advantage of them. The survey found that 1 in 3 of those youth on the street on any given night is LGBTQ. I came to testify today as a longtime gay activist to call on the city government and on the conscience of the LGBTQ community itself to wake up and urgently step up to come to the rescue of our homeless young people. It's widely known that young LGBTQ people make up a significant proportion of the sex worker industry in Philadelphia, meaning that our community is more open to taking advantage of our homeless young people than offering them help. Philadelphia has largely failed to address the solvable problem of youth homelessness in the city. Among those young people abandoned by that failure is the 1 in 3 who are LGBTQ. Personally, I am sick and tired that the city government and my own community continues to largely ignore this crisis. Tonight, hundreds of our own teens and young adults will have no home to go to tonight. It's time we do something about it. I commend Councilwoman Landau for speaking out for our community for more than just our legal rights. I pray that she will be able to mobilize city government and our community to once and for all invest in solutions for our homeless youth as well. We know what those solutions are. Our coalition's challenge is, when will we act? Thank you.
Good morning. My name is Jay Thompson. My pronouns are they, them. I come to you today, I sit before you today as a Philadelphian, as a social worker, and as a doctoral candidate. I come to look at you, to encourage you all to consider the solution-based actions that each and every individual has spoke about today to address, transform, and intervene on the acts that are homelessness, housing insecurities, food disparities, substance abuse, to take it seriously, but to understand that these are not preferences. These are not as a result of our choices or liking anatomy parts that we woke up one day and chose, oh, hey, I like this. No, for the record, this is serious. I exist. Our trans brothers and sisters who were slain existed. They still live on in history. These disparities are real because of no intervention and a lack of caring. That is considered a component of healing justice. Healing justice is the ideation of healing through addressing, intervening, and transforming your own traumas. Not listening, not caring, and not desiring to intervene is an inequity, and it is an injustice. If you do not care, nothing will change. As a result, folks will sleep on the streets tonight. Food disparities will continue. That is not caring. It is not intervening, and it needs to change. How? So many of us are present here today because we care. We are considered a part of that solution, and oftentimes we have done it without money in our pockets, also living on the streets, living pillow to post, hungry, and we fed and we tried. I only mention that I'm a doctoral candidate because the people behind me lifted me up. The community members lifted me up. I am only because of my community. My grandparents and my grandparents' grandparents, they were slaves. I no longer want to be a slave. The intersection therein is remembering who we are, but how will anyone ever know who they are and who they get to be if no one ever cares? We need you to care, not just because of a preference, but because it is our human civic right to exist within the United States of America that was started by 13 colonies of people who, in fact, were immigrants. Thank you.
Yes, yes, yes.
Esteemed members of the City Council, I'm Sappho Fulton, CEO and Executive Director of Women Beyond Borders, women spelled with an X. I stand before you today to address a critical issue facing our city, the urgent need for culturally competent reentry housing and supportive services for our LGBTQ IAP+ community, particularly justice-impacted transgender and cisgender women of color. Our proposed program getting from point A to point C, offers a beacon of hope for these individuals. It combines innovative therapeutic approaches, dialectical behavior therapy, and psychodrama in a culturally affirming environment to foster healing, resiliency, and personal growth. Philadelphia has seen an alarming incarceration rate among the population, often driven by complex trauma, substance use disorders, and mental health challenges. This program aims to break the cycle of recidivism by providing comprehensive trauma-informed care. By investing in this initiative, we can transform lives, reduce recidivism, and create a more equitable Philadelphia. I urge you to prioritize funding for this critical program. Thank you for your time and your consideration.
Thank you all very much. We appreciate all the wisdom that you imparted on us. Appreciate you.
Thank you, Ruth, for doing this work. We're going to hold you accountable for that training. Thank you.
Gotcha.
All right.
Can I ask
I expect nothing less, Safa.
Can I ask the question? Is there room?
Yes, please.
I know we talked a lot about intervening and solutions. Is there room under diversity, equity, inclusion to expand that, to create what that means and to actually intervene, to educate even your staff, the council members, so that there is never a time where another trans person has to sit in space and be misgendered?
Yes.
Is that an option?
That is absolutely an option. It's something that that my office had already reached out to the Office of DEI for, and we got an information session, but what we were asking for was a deep training session.
Sure.
And so it is absolutely going to happen, without a doubt.
Cool.
It is underscored today. It is absolutely going to happen. Yeah. Thank you.
Thank you.
I just want to quickly say that, this is a fairly new city council, and Council President Johnson's been really holding us to the table about being accessible, accountable, about also being transformative. And, I want to commend one of our newest council members who I've been working with for the past year now, Councilman Landau, because this is a way that we're trying to move things. So, a lot of times people don't understand there's a lot of bureaucracy in the city, and people like Rue Landau are trying to navigate through that bureaucracy to get things done. And so one of the things that she has been big on asking all of us is, understanding what we, being more mindful and thoughtful about being inclusive, finding ways to get things done for this particular community, but most importantly, just be transformative. So I just want to commend Councilman Rue Landau for changing the game in City Council when it comes to this world. So it's going to be more done because of her.
Thank you, Kelly.
Is it fair to also say, just for the record, Councilmember Phillips and others, that a lot of what we are talking about is not new? And I know that we are pressed for time, but queer and trans people have existed for centuries. And then the intersection therein, blackness, has existed for centuries. So the ask in transformation is not just to include, but to see.
Yes.
Because I've been black my whole life, and you can see that. The thing is, you have to now learn to accept my queerness. And I didn't ask you to like it. I just asked you not to kill us.
I agree. And I thank you for that. And one of the things I will say is that what I've taken from this hearing, which is really important, because this is why all of the council members have various focuses that they're trying to push through the city. Like for me, children and youth infrastructure, quality of life is huge. For Jamie Gaudier, that's housing. Everyone has their niche, but the great thing about Councilmember Landau, this is one of the things that's really important for her. Now that helps us understand what we need to do to support this particular initiative, because she's putting a lot of time and research on it. And so now we just have to support her with the work that she's doing. And so that way we are covering, by us focusing on every part of the city and different issues, it helps us bring everything together so no issue is left behind. And I want to say, because of your testimony today and everyone else's testimony, I've learned a lot. I've learned a lot about the fact that housing is still a significant issue for especially a lot of our young people. I've learned that bullying is even more of an expansive issue than I thought it was, even though I knew it was. And now I want to figure out how we can get the school district more involved with this particular issue. And I've also learned about the health and security stuff. I mean, I think, you know, for a long time, the Mazzoni Center has been known as the space that I've understood, but I recognize now there needs to be more spaces that have better training. And hunger, which you mentioned, is like still huge. I mean, we got Fill Abundance, Share Food, all these places that pose to feed people, but I'm like, how are people still hungry? So, you know, with Councilmember Landau's leadership, hopefully, and I know she's gonna make sure that we do something about it. All right, thank you.
Thank you.
Thank you.
Jay, I just want to add,
Yeah.
I hear you. This is all of our issues. For all 17 council people throughout the entire city, every district, citywide, LGBTQ people live in every single area of the city, and sadly what you're saying is sometimes don't live in a particular part of the city. So we will all collectively crack this problem and come up with solutions, I promise you.
Thank you all.
Thank you. Mr. Sarek, can you call the next panel?
Natalie Proud, Alexia Clark, Apurva Tandon.
Could you please call 2 more names?
Can I also have Andrew Spires and Sergio Sia?
Thank you. Can you please state your name, your pronouns, and proceed with your testimony?
Natalie Proud, she, her. Good morning. I'm the Program Director for Covenant House, Pennsylvania. Thank you for allowing us to speak today. Across the nation, 40% of all young people experiencing homelessness identify as LGBTQ+, despite only 7% of young people nationwide identifying that same way. LGBTQ+ young people are 120% more likely to experience homelessness than their straight cisgender peers. When they find themselves without a stable home, these young people face unique dangers. They are disproportionately exposed to physical and sexual violence and are particularly vulnerable to human trafficking. 90% of transgender young people report being offered money for sex while experiencing homelessness, often due to discrimination in employment and housing that traffickers exploit. Transgender young people are not fetishes. They are our loved ones. They are our neighbors. They deserve the same rights as everyone else. For many LGBTQ young people, homelessness begins with family rejection, followed by systemic exclusion from secure housing, healthcare, education, and job opportunities. Most heartbreaking of all, these young people are less likely to sleep in shelters than they are to sleep in the streets or on strangers' homes, knowing that some shelters assign beds based on sex at birth or lack adequate safety measures to protect their identities. At Covenant House, we firmly stand against this approach. We were the first shelter in Philadelphia to allow transgender youth to choose a bed that aligns with their sense of safety rather than their assigned sex at birth. As the only youth-specific shelter in the city serving people 21 and under, we are often at capacity, seeing firsthand the urgent need for greater support. Our LGBTQ+ youth deserve safe and equal access to shelter without fear of judgment or discrimination. As providers, we are not here to perpetuate the harmful biases that these young people have endured. We are here to end them. In the city that prides itself on being the city of brotherly love, we must commit to building a system that actively funds safe, affirming spaces for LGBTQ+ youth. Today, we urge you community leaders to invest in shelters and services that affirm every young person's right to safety, dignity, and respect. Together, we can create a future where no young person has to choose between their identity and a safe place to sleep. Thank you.
Good morning, council members. My name is Sergio Sia. I use el, he, him pronouns. I'm the political director of Reclaim Philadelphia, a proud queer man, and a daily PrEP user, which I use to protect myself and my community from HIV. I would like to address two positions being pursued by Mayor Parker and the City Council that will directly impact the health of the queer community here in Philadelphia. I'm wearing a reprint of an ACT UP New York t-shirt. ACT UP established the first successful needle exchange program in New York City to directly confront the HIV crisis that killed so many of my queer ancestors. Since then, decades of research have shown that syringe needle exchange effectively prevents spreads of HIV, hepatitis, and other blood-borne illnesses. Parker has zeroed out funding for needle exchange in Philly, something she said she will fight tooth and nail. This while Philadelphia is rated the #1 big city for rates of HIV and STIs by the CDC, who compared our city compared to 100 other cities. The city also told Philadelphia in a letter that taking away funding from safe needle exchange will lead to increases of HIV infections in our city. Kathleen Brady, who is the city's director of HIV health, also told City Council that this will lead to an increase in HIV and other illnesses in our city, and does not expect philanthropic or private donations to make up the deficit for the funding. And the benefits that we get from safe needle exchange are pennies to the dollar when it comes to the people that are going to be infected, and impacted. I also want to speak as somebody who works in Chinatown, somebody that supports the No Arena and Chinatown movement, and somebody who supports the No Arena and Neighborhood group that has been organizing around this. With anti-trans legislation being proposed or passed into law across the country, particularly trans people are needing places where they can get queer-focused or gender-affirming healthcare and resources that are vital to their safety. Philadelphia's Neighborhood is one of those safe havens, being home to service provider centers like Mazzoni and William Way. I myself go to Mazzoni in the past when I didn't have health insurance. I used to go to their walk-in clinic just last week because I had a partner who was worried about an infection. I got tested at the health center in South Philadelphia, which is far from West Philadelphia where I live. Policies and developments that disregard the fact that these are safe havens for queer folks is part of the problem and only contribute to the continuing inequities in healthcare for queer people in our region. And one example, like I said, is the 76th Place Arena. Studies have shown that it would create regular gridlock traffic in Center City that would limit access to vital LGBTQ plus healthcare and community centers in the neighborhood, not just for Philly residents, but for people all over the greater Philadelphia region coming to the neighborhood to get affirming healthcare. We know that access to affirming healthcare can quite literally be life-saving for queer folks. The Trevor Project did a study in 2022 that showed 54% of trans and non-binary youth in Pennsylvania had seriously considered suicide in the past year, on top of the existing barriers to healthcare access that already exist, that have made this number so upsettingly high. It is deeply irresponsible to pursue projects that add more barriers for LGBTQ people, especially youth, in the very spaces that are needed. And from what I've heard, the Community Benefits Agreement does not name at all the neighborhood or name any benefits that will be thought of when it comes to the impacts on the neighborhood. And like I said, you know, I went from West Philadelphia to get tested for STIs in South Philadelphia. I think health centers across Philadelphia should have the same kind of access so that I don't have to go somewhere across the city. And I'm thinking of people in Northeast and other people. We do have a higher concentration of queer folks in the neighborhood, but queer people exist all over Philadelphia. And I also want to make sure that sexual health care isn't something that just is something that's going to impact queer folks. Discontinuing safe needle exchange is going to impact all people. And that's because people who have sex with LGBTQI folks don't identify as such, and people who share needles with LGBTQIA folks don't always know the identities of the people that they're sharing needles with. So yeah, I would encourage City Council to restore funding for safe needle exchange in Philadelphia, and also vote against any legislation that would allow an arena in the heart of our city. Thank you.
Good afternoon. My name is Andrew Spears. My pronouns are he, him, and his. I am a person of queer and trans experience and a licensed social worker in the state of Pennsylvania. Since 2011, I have lived in Philadelphia and worked with LGBTQ+ individuals experiencing homelessness. Currently, I serve as a senior program manager at the Corporation for Supportive Housing, a supportive housing nonprofit working in the federal technical assistance space. Studies show us that approximately 17% of sexual minority individuals have experienced homelessness at some point in their lives, and a whopping 30% of trans folks report experiencing homelessness. Since 2017, the number of transgender individuals experiencing homelessness in the United States has increased by 57%. And all of these percentages increase exponentially when we look at the experiences of racial minority LGBTQ individuals. Like most places in the United States, homelessness has increased in Philadelphia for the third year in a row. The 2024 point-in-time count showed a 10% increase in homelessness over 2023, and we've surpassed 5,000 individuals experiencing homelessness for the first time since 2020. While we don't have comprehensive SOGI data, we know that about 1.4% of the population in the Philadelphia metro area identifies as trans or gender nonconforming, and trans and gender nonconforming people make up about 2% of those experiencing homelessness in Philadelphia, which is more than twice the national average. It's no secret that LGBTQ+ individuals experience disparities in many areas of life. I focus my comments on housing because housing is among our most basic of human needs and human rights. Without a place to live, not one of us can thrive. People cannot adequately address their health needs, pursue educational goals, or obtain gainful employment without housing. Equity for LGBTQ+ Philadelphians has to start with access to safe, quality, affordable housing. In the past 10 years, 14 of my former clients and trans community members have died. And these are only the individuals I had personal connection to. Many died from transphobic violence, some from overdose, and others from chronic health complications. In every case, their history of homelessness was a significant contributing factor in their death. While LGBTQ+ Philadelphians are fortunate to have access to affirming services like RHD's Morris Home and the Ark of Safety, the need for support overwhelmingly outpaces the availability of beds. We need more resources and services, and we cannot secure funding for necessary resources and services without data. The 2024 point-in-time count summary was the first to exclude data on race, gender, and ethnicity since the PIT count started in 2014 in Philadelphia. We need to be able to track LGBTQ+ and BIPOC individuals experiencing homelessness in order to better advocate for more services. To solve the problem of homelessness and meet the needs of our most vulnerable community members, namely BIPOC, LGBTQ+ people, we also need diverse stakeholders and partners to come to the table. If you believe in equity for LGBTQ+ people, you should care about homelessness. If you believe in racial justice, you should care about homelessness. If you believe in disability rights, you should care about homelessness. And if you are concerned that Philadelphia is the poorest big city in the United States, you should care about homelessness. I'd like to extend an invitation for those here to attend a free event next month. On Thursday, November 21st, a free screening of the documentary Beyond the Bridge, A Solution to Homelessness, and subsequent panel discussion will be held at the Philadelphia Film Center, presented by CSH, Pathways to Housing PA, the Bethesda Project, Camden Coalition, the Homeless Advocacy Project, and the National Homelessness Law Center. The Beyond the Bridge film crew drove over 40,000 miles to visit 12 cities and talk with dozens of service providers, people with lived experience, and policymakers to figure out how we can solve homelessness in a comprehensive way. I'll give you a sneak peek and say that the answer is working with deep coordination. A single homelessness response systems plan based on the principles of housing first, with community buy-in from law enforcement, judicial systems, business communities, service providers, volunteers, and leadership from the mayor and county executives. I hope you will join us to be part of the solution.
Thank you. Thank you all so much. I'll be there, I think. I'm 90% sure I'll be there.
Please email it if you can.
Thank you very much.
Thank you.
Thank you. Appreciate you. Can you please call the next panel?
Jasmine Henderson, Trudine Hay, and Zeke Powell.
You want to sit on it?
Thank you. Can you, whoever wants to start, please state your name, pronouns, and look forward to your testimony.
Hello, my name is Zeke Powell, and I am a co-founder of the Black Visioning Group. We are a Black, trans, queer, centered and led, what do we do? We're a guaranteed income program, we do housing, and our goal is to own several houses in the city for housing for Black trans Philadelphians in perpetuity. As we know, all over the country there are a lot of laws being passed that will definitely lead to more trans folks coming into Philadelphia as a sanctuary. And a lot of those people will not be Black or brown. And as you mentioned earlier, the marginalizations we face are taxes, right? And so Black Philadelphians who are under the LGBTQ+ umbrella are actually subsidizing the experiences that people have in the neighborhood, subsidizing the experiences and the freedoms that people have who come here from like Georgia to be here, while Black, queer, trans Philadelphians who are from Philadelphia, who are families rooted in Philadelphia, are struggling with the homelessness, are suffering. And so our program is through the lens of reparations, because suffering has subsidized, it's time to pay it back, equity, right? And we believe that the solution to poor people's problems is to give them money directly and to overcome the racist, really just the racist anti-giving poor people money laws, because when Black labor was never free in this country, it came at a cost, the cost of suffering, and the epigenetic cost that we still experience to this day. And the legal, there's still legal discrimination still happening. And so we just invite you all to interrogate your biases against guaranteed income and against reparations, to recognize that these are racist and outdated ways of thinking. People who receive guaranteed income work. People who receive guaranteed income do not spend the money on, frivolous stuff. They spend the money on food, spend the money on fixing their cars, going to work. I personally am not able to keep a full-time job because I'm disabled, but receiving the guaranteed income has filled the gaps that, the application for SSI is really fraught. And so being able to have enough money is an answer to so many problems, so many. And rather than institutional, well, I'm just gonna say that. So giving people money, guaranteed income, reparations. Thank you.
Good afternoon. My name is Trudy Ann Hay. My pronouns are goddess and queen. I had printed something out that I was gonna read, and just listening to everyone talk today, I kinda wanted to redirect my direction. When it comes to homelessness, I think a lot of times people have this idea that you have to be gay, or you gotta be on drugs, or uneducated or something when it comes to homelessness, which seems to be one of the larger topics about today. And I just wanted to say that I was homeless at 16 years old as a Black LGBT+ immigrant. Nobody knew that I was homeless because I didn't look homeless. I was still going to school, but I was sleeping at Broad and Holony with no type of resources within the community, which is why I started my foundation called ITAF Foundation, which stands for It Takes a Village Foundation. Now, It Takes a Village Foundation is a community support organization that's based on, we focus on social issues, especially when it comes to our immigrant community, especially our LGBT+ immigrant. A lot of times because we're Black and brown, we tend to blend into the background, but there's no resources that's actually out there for immigrants who are LGBT+. We often get overlooked because we blend in, especially when it comes to healthcare. Now, in addition to me being the founder at ITAF Foundation, I'm also the executive director of the Bird Cancer Foundation, and we see disparities that exist on both sides of the organization. When it comes to the LGBT+ immigrants, in housing, healthcare, employment, education, all of those things, we work with our marginalized communities to help support them, especially when it comes to the cancer care, maternal health, mental health, all of those things affects the LGBT+ communities. Only a few of them, well, you know, I hear a lot of people talk about the healthcare and all of those things, but there's so much more. But one of the big things also is the funding. We legit just sat here and here they talk about how it takes months for funding to come in. I also experienced those things. There's a lot of nonprofit here in Philadelphia, community, boots on the ground nonprofit organization here are doing the work. But when it comes to funding, when it comes to the support, it seems like we're like pulling teeth just to be heard or even get the support that we need. So I really don't have really much to say because I feel like everybody that's came here today said what they need to say because we are all in this together. And if we can all come together as well, because I feel like everybody's just in their own lane. This only matters to me, this only happens to me. It all affects us. So if we can come together to just fight the common cause, it's also a good thing, which is why this hearing is also important. So thank you for inviting me, and thank you for taking the time to listen, and hopefully we can work on this together. But housing in Philadelphia in 2024 is ridiculous. Like, come on. It's ridiculous, but that's all I have to say.
Thank you, and thank you for adding the immigrant voice to this conversation. Appreciate it. Jasmine.
Again, Jasmine Henderson, she, her. I honestly wanted to address what Councilmember Phillips had said earlier about this being a fairly new city council and a lot of y'all are learning on the job. I've lived in Philly for 11 years. I've been coming to city council meetings, protesting outside, working with different organizations, protesting for housing, healthcare, mental health care, all this other stuff. Granted, some of y'all are just sitting here, but in the 11 years I've been here, we made it plainly clear what was needed, and that was less cops and more money to stuff that helped the actual community. Even with this being a new city council, did we see any pushback on the mayor's budget? Was there a cut to what she wanted to add to the police budget? No. Did city council force her to fund syringes? No. But we know more cops does not equal more safety. It equals more black and brown LGBTQ folks in jail, right? We know that less syringes does not equal safety in Kensington, as opposed to what she wants us to believe, is going to lead to more people becoming HIV positive, Hep C positive, Hep A positive on top of this. So for us to be told again and again by whoever is the city council members that we're still learning, we don't get it, we're trying to understand, like, you show me your budget and I'll show you your priorities. And in this particular case, city council has shown us again that the priority is for the mayor and doing the things that are harmful to this city instead of taking care of the people who actually need to be taken care of. And it's a constant. We shouldn't, and why do we have the police budget that we have? Has crime gone down? Not according to what you hear in the news, right? Like, is homelessness being solved? No. But are we seeing an increase in that budget? Not to my knowledge. We've got people out here who have mental health issues. We know they have mental health issues. Are we seeing an increase in the mental health budget to deal with people, to help people with these issues? Not really. Not at the level that we need. We know that we have people with an opioid addiction who need special beds, special setups, so that because there's now other drugs perverting that supply, so they need special setups in order to get the treatment that's needed for them. They don't need to be forced between jail or this treatment that's not going to help them or is going to kill them. But these are the things that we see our mayor doing, and we're watching city council fund her do it. So that's all I had to say. It was just like, it's a matter of priorities. And we don't always get to talk to our city councilors, but what gets funded and what doesn't shows us exactly where priorities are.
Thank you very much. We appreciate you.
I will say, thank you for that. I think for a lot of us, when you look at, I'm not new, right? So I'm not gonna act like a new thing is an issue with me, but I will respect my colleague to the left and my colleague to the right. They will fall under that category. I'm hoping that in next year's budget cycle, you come back with that exact same energy, because at the end of the day, I can't sit here and say you're wrong about what you said. I think for a lot of us, and I can't speak for everybody, but I will speak for me, you kind of give folks a courtesy with the first budget to be able to set the priorities that they campaigned on based on the fact that the constituents of Philadelphia chose the current mayor that we have right now. So, you know, respectfully, I do think that everything you said is credible, it's legit, and I'm hoping that we do better in next year's budget and you come back and you're a little more satisfied, because I know that council members are already in dialogue around some of the things specifically that you listed to figure out what do we do and how do we offset some of those problems. Because you're right, a budget is a moral document and it does communicate what your priorities are. And I'm taking your testimony today as a challenge. And I'm hoping that we return in the spring with a document that is a moral document that's a little better to your liking, as well as the people who came here to advocate for the things that you advocated for. So I just don't want you to think that what you're saying falls on deaf ears. We really hear you. It resonates with me, and I'm whispering to the vice chair of this committee who's chairing this hearing. Please know that your words have value. So thank you.
And thank you for saying that. And just for the record, it is appreciated by the community, by the people of Philadelphia, that for once we had the table. We weren't begging for a seat, we were at the table, and we were heard. This is the first time in all of my time coming up here to testify that we weren't put on the back burner for the administration, right? Every budget hearing is the same thing. The administration comes forward with what they want, then the people come forward to testify with what they want. But by the time the people come forward to testify, administration's left, half the council's not sitting here, so we're not heard.
So let's do something about that. One of the things that we started last year, and I give our Council President Johnson, a lot of credit, we began last year to do remote budget hearings. We went to different districts across the city of Philadelphia. We held the hearings in the evening so we can give some flexibility to people in their work schedule. And we also did a lot of listening. We allowed people to testify about what was important, what they felt like we should fund, and what they advocated for in their particular constituency basis. I'm wondering if maybe you can work with Councilmember Landau's office, and she's been doing an amazing job of leading this process to make sure that when we plan our remote budget hearings next year, that another opportunity is presented so you don't feel like this is a one-off situation, because I don't think that that would be what's best based on the testimony I'm hearing, your experiences in the city of Philadelphia, and a level of advocacy that's happening here today. So maybe that's another small solution that we could have to recreate this platform when we're actually talking about dollars and cents and some of the things that you just addressed here today.
I appreciate that, Councilman.
Thank you all very much. Mr. Sarah, are there any more people here for public comment?
The final speaker offering public comment is Taylor Baker.
Okay, thank you. This concludes the public hearing. Oh, sorry. My apologies. My apologies. Please state your name, your pronouns, and proceed with your testimony.
Hi, my name's Taylor Baker, she, her. I'd like to ask we all take a moment.
I'm sorry, just can you repeat that? I didn't hear you, and I just want to make sure that everybody heard you over here for the record.
My name's Taylor Baker, she, her. I'd like to ask we all take a moment to think of the people sleeping on the streets that we passed to get here today, sleeping in the corner of the subway below us, and on grates to stay warm. 40% of homeless youth are LGBT. We know this. Also, seniors are one of the fastest growing groups experiencing homelessness. We know this. Knowing these facts, it's critical to make sure that there's enough affordable housing for queer people, from youth to seniors. We do have the John C. Anderson Affordable Housing Apartments in the neighborhood, which has been a model for other cities. It's our public servants' responsibility to take a holistic view of the community and ensure issues like gentrification don't create further barriers to housing for queer folks who already are at a disadvantage. It's disappointing, to say the least, that City Council would consider a development like 76 Place that's basically guaranteed to drive up prices in the surrounding neighborhood and push out the most vulnerable people, including queer folks who need affordable housing and have made themselves a home. The folks at the Anderson Apartments are talking about this, and they aren't the only ones. Predatory development is antithetical to addressing housing inequities for queer people when we have such high proportion of homelessness. So why haven't you opposed the arena publicly, and why aren't you leading efforts to house LGBT folks by filling, say, the 13,000 empty homes that the PHA has sitting and rotting, waiting for developers to make more money on? Thank you.
Thank you very much. Appreciate you. Any more people signed up for public comment?
There are no more speakers for public comment.
Okay. So thank you very much, everybody. This concludes the public hearing of the Committee on Legislative Oversight. Oh, first closing remarks. I have a couple.
Just want to thank Councilmember Landau for.
Thank you. I want to thank everybody who testified today. I want to thank you for your courage, your earnestness. We heard you. Your courage for telling your personal stories, and for everybody who you're advocating for. You are the leaders and the pillars of our community. You create safe havens for us. You've created a network for people to stay alive. And while it's so heartening to know about the incredible work that you do, it is clear as day that every year we come here and every year we hear there's so much more work to do. We know that this discussion today isn't just about policy, that all the stories that you're telling are actual, and the statistics that we hear are people's lives. These are the young people you were, the young people who exist today, and the folks who are coming up now. And we have an obligation to make sure that what has transpired until now never, ever repeats itself, and that we make a safe city for every single member of the LGBTQ plus community, to make sure young people have safety in schools, a roof over their heads, food in their stomachs, and a pathway to sustain themselves in lives. So we will continue to work on this. This is just the beginning. We thank you all for all of your advocacy and your work. You guys are the ones on the ground. You're the heroes here. Thank you. And while we're concluding this hearing, we are not concluding our work. Appreciate you so very, very much. Thank you. And now, it's just the second hearing I've ever chaired. This concludes the public hearing of the Committee on Legislative Oversight. This committee will stand in recess until the call of the chair. Thank you all very much.